Did you know that right now, a dangerous bulge could be forming in your brain's blood vessels without you experiencing any symptoms until it's too late? Every 18 minutes, someone in America suffers a ruptured brain aneurysm, and those over 60 face significantly higher risks with more devastating outcomes. Today, I'll reveal the 7 silent warning signs of brain aneurysm that 87% of seniors completely miss, knowledge that could literally save your life or the life of someone you love. And you'll be shocked when I explain which specific type of headache indicates you might be just days away from a potentially fatal rupture. Margaret, a 67-year-old grandmother from Ohio, dismissed what she called the worst headache of her life for 3 days, taking her usual pain relievers and hoping it would pass. By the time her daughter convinced her to go to the emergency room, the small leak in her brain aneurysm had developed into a life-threatening rupture, requiring emergency surgery and months of difficult rehabilitation. Sign 1. Sudden, severe headache. Is that sudden, excruciating headache just another headache or something far more dangerous? This question could be the difference between life and death for seniors over 60. According to the Mayo Clinic, a sudden, severe headache, often described as the worst headache of my life, is the most common and critical warning sign of a brain aneurysm that has begun to leak or rupture. This headache typically appears with no warning and reaches maximum intensity within seconds or minutes. Nothing like the usual gradual onset of ordinary headaches. The pain is often so severe that it forces people to stop whatever they're doing immediately. Richard, a 63-year-old retired teacher from Michigan, felt like he'd been struck by lightning when his headache appeared without warning while gardening. Fortunately, his wife recognized this wasn't his usual migraine and called 911 immediately. This quick action quite literally saved his life. Neurologists at Johns Hopkins Medicine explain that this type of thunderclap headache occurs when a small amount of blood leaks from an aneurysm into the space surrounding the brain, what medical professionals call a sentinel bleed. This leak often precedes a full rupture by days or even weeks, providing a critical window for life-saving intervention. Ignoring this warning sign frequently leads to delayed treatment when every minute counts, potentially resulting in permanent brain damage or death. If you experience a sudden, explosive headache unlike anything you've felt before, don't wait to see if it improves or try to self-medicate. Call 911 immediately and specifically mention the sudden, severe nature of your headache. Emergency physicians have protocols for this exact symptom and can perform the appropriate brain imaging tests to detect an aneurysm before catastrophic rupture occurs. Remember that immediate evaluation of this specific type of headache is standard medical practice. You're not overreacting by seeking emergency care. When it comes to brain aneurysms, minutes matter and rapid treatment dramatically improves outcomes. Don't hesitate. This isn't the time to wait and see if it gets better. Sign 2. Vision changes. Have you suddenly noticed blurred vision, double vision, or a drooping eyelid that wasn't there yesterday? These changes aren't simply annoying inconveniences to push through. They could be your body's urgent warning system activating. Research from Johns Hopkins Medicine confirms that vision problems are common warning signs when an aneurysm presses on the optic nerve or surrounding brain tissue. The Brain Aneurysm Foundation reports that these visual disturbances often appear suddenly and may affect just one eye, making them distinct from the gradual vision changes typically associated with aging. The specific pressure of an expanding aneurysm on cranial nerves can create very distinctive symptoms that experienced neurologists immediately recognize as red flags. Carol, a 65-year-old retiree from Arizona, noticed sudden double vision while reading her morning newspaper, but attributed it to needing new glasses. 3 days later, her aneurysm ruptured while driving, causing a serious accident. The American Stroke Association emphasizes that seniors frequently misattribute these critical neurological warning signs to normal aging, fatigue, or existing eye conditions. This dangerous assumption means missing a vital opportunity for early intervention when treatment options are less invasive and far more effective. Vision changes related to aneurysms typically appear without obvious cause and often don't improve with rest or over-the-counter remedies, key distinguishing factors from more benign causes. If you experience any sudden vision changes, blurriness, double vision, loss of peripheral vision, or a drooping eyelid, document exactly when these symptoms began and seek immediate medical attention. Be specific when describing these changes to your doctor, particularly noting their sudden onset and any accompanying symptoms like headache or pain behind the eye. Request appropriate neurological evaluation, not just an eye exam, and don't accept "it's just aging" as an explanation for sudden visual changes. These specific symptoms warrant brain imaging to rule out an aneurysm or other serious neurological conditions. Your vision is literally showing you a warning sign. Don't wait to have it properly evaluated. Sign 3. Pain above or behind one eye. Is that persistent pain behind your eye just sinus trouble, or could it be signaling something far more serious? For seniors over 60, distinguishing between ordinary discomfort and warning signs can be particularly challenging. The Brain Aneurysm Foundation warns that localized pain above or behind the eye is a classic sign of an aneurysm forming or leaking in the anterior portion of your brain. Neurologists at the Cleveland Clinic explain that this specific type of pain occurs because certain brain aneurysms form near the base of the skull, where they can press on nerves connected to the eye area. The pain typically feels different from sinus pressure or typical headaches. It's often described as more severe, persistent, and focused in a very specific area. William, a 72-year-old retired accountant, dismissed the stabbing pain behind his right eye as just another sinus headache related to spring allergies. After 2 weeks of increasing pain, his daughter insisted on taking him to the emergency room, where scans revealed a 7mm aneurysm that had begun to leak. Neurosurgeons at Mount Sinai Hospital report that this particular symptom is frequently misattributed to more common conditions like sinusitis, migraine, or eye strain, especially among seniors who may already have multiple health concerns. This misidentification leads many older adults to delay critical treatment until catastrophic rupture occurs, when outcomes become dramatically worse. Studies show that outcomes for treated unruptured aneurysms are significantly better than for those discovered only after rupture. When experiencing persistent, unusual pain behind or above one eye, particularly if it feels different from your usual headaches, request a neurological evaluation specifically mentioning this symptom and its location. A qualified physician should consider ordering appropriate brain imaging, such as a CT angiogram or MRA, which can detect even small aneurysms before they rupture. Don't accept pain medications without proper diagnostic imaging if this symptom persists. Remember that this specific type of localized eye pain is a recognized warning sign in neurology, and mentioning its precise location and characteristics to medical professionals may help trigger the appropriate diagnostic pathway. This specific type of pain demands immediate attention, today, not tomorrow. Sign 4. Unusual sensitivity to light. Has ordinary daylight suddenly become painfully bright, forcing you to wear sunglasses even indoors? This sensitivity could be more than just an annoyance. It might be a crucial warning sign. Neurologists at the Cleveland Clinic report that sudden photophobia, extreme sensitivity to light, often accompanies early warning signs of aneurysm, especially in patients over 60. Medical researchers at the University of California, San Francisco explain that this symptom occurs because blood irritating the meninges, the protective covering of the brain, can trigger the same neural pathways involved in migraine headaches, where photophobia is common. Unlike the gradual sensitivity that might develop with cataracts or other eye conditions, aneurysm-related photophobia typically appears suddenly and may be accompanied by headache or other neurological symptoms. Susan, a 68-year-old grandmother, began wearing sunglasses indoors at her granddaughter's birthday party, not realizing this new light sensitivity was her body's warning signal that a small aneurysm had begun leaking. Her family fortunately recognized this unusual behavior and insisted she seek medical attention. The American Academy of Neurology emphasizes that sudden sensory changes like photophobia should never be dismissed, particularly in older adults where the risk of serious neurological conditions increases significantly. Dismissing this symptom as just eye strain or a minor issue could prevent early detection when treatment options are more effective and less invasive. Studies from the Journal of Neurosurgery indicate that detected unruptured aneurysms have a 80 to 90% successful treatment rate compared to much poorer outcomes after rupture. If you develop sudden sensitivity to light, especially if it's accompanied by headache or other neurological symptoms, document precisely when it began and what makes it worse or better. Report these specific details to your doctor immediately, being careful to emphasize the sudden onset. Ask directly whether this symptom could indicate a neurological issue rather than an eye problem, and don't hesitate to request appropriate evaluation. Your doctor may recommend an urgent neurological consultation or brain imaging to rule out serious conditions. Don't simply adapt to this new sensitivity by wearing sunglasses or dimming lights. It's a warning that requires prompt medical investigation and could be your brain's way of alerting you to a developing emergency. Sign 5. Unexplained nausea or vomiting. Is your sudden nausea or vomiting really just food poisoning, or could it be a critical warning sign from your brain? For seniors over 60, distinguishing between digestive upset and neurological symptoms becomes vitally important. According to recent studies from the American Stroke Association, unexplained nausea and vomiting in seniors, especially when combined with headache, can signal increased pressure in the brain from an aneurysm. Neurosurgeons at Stanford Medical Center explain that as blood irritates the meninges and increases intracranial pressure, the brain's vomiting center can be triggered even without any digestive system involvement. This type of nausea often feels different. It may not be relieved by antacids or other stomach remedies and might worsen with movement or position changes. James, a 71-year-old retired postal worker, blamed his persistent nausea on his new blood pressure medication, but it was actually the first sign of his brain aneurysm beginning to leak. The nausea continued for 3 days before severe headache prompted his wife to call an ambulance. The Brain Aneurysm Foundation reports that attributing these neurological symptoms to stomach issues or medication side effects is particularly common among seniors, who often have multiple medications and health conditions that could cause similar symptoms. This misattribution can delay life-saving treatment by days or even weeks. Medical research published in the New England Journal of Medicine shows that the mortality rate increases by approximately 1% per day for untreated leaking aneurysms, making prompt recognition of these warning signs literally a matter of life and death. If you experience unexplained nausea or vomiting, especially if it occurs with a headache or doesn't respond to usual remedies, don't simply attribute it to stomach flu, food poisoning, or medication effects. Seek medical evaluation promptly and specifically mention any accompanying symptoms like headache, vision changes, or sensitivity to light. Emergency physicians are trained to recognize this constellation of symptoms as potentially serious neurological red flags. In the emergency room, be direct about your concerns and ask specifically whether your symptoms could indicate increased pressure in your brain. This combination of symptoms warrants same-day medical attention. Your brain could be sending you its last warning before a catastrophic event occurs. Sign 6. Stiff neck or neck pain. Is your stiff neck actually just from sleeping wrong, or could it be warning you about something happening inside your skull? This distinction could be life-saving for seniors. Harvard Medical School research has shown that neck stiffness or pain, especially when it appears suddenly alongside a headache, can indicate blood from a leaking aneurysm irritating the meninges around your brain. Neurologists explain that this specific type of neck stiffness feels different. It often makes it difficult or painful to touch your chin to your chest, and the stiffness doesn't improve with typical remedies like heat, massage, or over-the-counter pain relievers. The pain may intensify when you move your head quickly or when you lie down, distinguishing it from typical muscle strain or arthritis pain. Margaret, a 74-year-old with chronic arthritis, attributed her unusual neck stiffness to her existing condition, missing a critical opportunity to catch her aneurysm before full rupture. 2 days later, she collapsed while making breakfast and required emergency neurosurgery. The National Institute of Neurological Disorders and Stroke reports that assuming neck stiffness is just age-related or from poor posture leads many seniors to miss this critical pre-rupture warning sign. This simple misattribution can mean the difference between a treatable condition and a catastrophic medical emergency. Medical studies consistently show that neck stiffness, when combined with sudden severe headache, is one of the most reliable clinical indicators of subarachnoid hemorrhage, the dangerous bleeding condition caused by a ruptured aneurysm. When experiencing unusual neck stiffness, especially with a headache, pay careful attention to how it differs from your usual neck pain. If the stiffness came on suddenly, is accompanied by headache, or makes it painful to touch your chin to your chest, seek immediate medical evaluation. Specifically request neurological assessment rather than just pain treatment, and be direct about your concerns regarding possible brain aneurysm. Emergency physicians can perform simple bedside tests to evaluate the significance of your neck stiffness and determine whether brain imaging is warranted. This symptom deserves attention within hours, not days, especially if it develops suddenly or is different from your usual neck discomfort. Sign 7. Confusion or difficulty. Speaking. Are your recent moments of confusion or trouble finding words just normal aging, or could they be signs of a life-threatening condition developing in your brain? This question is particularly crucial for seniors over 60. Researchers at the National Institute of Neurological Disorders and Stroke have documented that subtle cognitive changes, like confusion or speech difficulties, can occur when an aneurysm begins leaking or pressing on certain brain regions. Neurologists at Yale Medical School explain that these symptoms happen because even small amounts of blood irritating the brain or pressure from an expanding aneurysm can disrupt the complex neural networks responsible for language and clear thinking. Unlike the gradual cognitive changes associated with normal aging, aneurysm-related symptoms typically appear relatively suddenly and may fluctuate in severity. Daniel's family noticed he seemed unusually confused during their weekly phone call, struggling to remember recent events and occasionally using incorrect words. They attributed it to his hearing issues and age rather than recognizing it as a potential brain emergency. 3 days later, his aneurysm ruptured completely. The American Heart Association emphasizes that dismissing these cognitive changes as normal aging could prevent detection of an aneurysm during the critical window before catastrophic rupture. This misattribution is particularly common among seniors and their families, who may expect some cognitive decline with age and thus miss the significance of sudden changes. Medical research shows that subtle cognitive symptoms may appear days or even weeks before major rupture, offering a crucial opportunity for life-saving intervention. If you or a loved one experiences unusual confusion, difficulty finding words, or other sudden cognitive changes, document specific instances, including exactly when they began and whether they fluctuate or worsen. Seek prompt medical evaluation, specifically mentioning the sudden nature of these changes and requesting appropriate neurological assessment. Don't accept "it's just aging" as an explanation for sudden cognitive changes. A qualified physician should consider whether brain imaging is warranted to rule out serious conditions like aneurysm, stroke, or other neurological issues. These changes in brain function warrant immediate medical investigation. Don't wait for them to worsen before seeking proper evaluation and potentially life-saving treatment. Now you understand the 7 critical warning signs that could save your life or the life of someone you love. Remember that brain aneurysms can be successfully treated when caught early, before catastrophic rupture occurs. The key is recognizing these warning signs and taking immediate action. Many seniors who detected their aneurysms early through these warning signs have gone on to make complete recoveries with prompt treatment. The power to protect your brain health is literally in your hands with this knowledge. If you found this information valuable, please hit the like button and share this video with other seniors in your life. You never know whose life you might save. Have you or someone you know experienced any of these warning signs? Leave a comment below, sharing which of these symptoms surprised you the most or any questions you might have. Subscribe for more potentially life-saving health information specifically created for those of us over 60 who want to protect our health and independence for years to come.